Okay, well, welcome to 2024 Friday edition of Midwest Implant Institute Surgical Series. So we got tooth number 24 and 25 that are missing. Just had reinforced to me that he lost these teeth when he was a kid. Got hit in the face with he was a pitcher, got a line drive with a baseball bat. So or with a baseball, coming off a baseball bat. So what we're going to do here now is we're going to come in here and see if we can't recreate some teeth for this young man. God willing, we'll be able to. All right, let me have the Woodson one, please. So we're going to make an incision, splitting our keratinized tissue just like we normally do. Going to reflect the soft tissue here, and I'm going to reveal what we've got here that we're seeing on our CBCT, which is got a pretty thin ridge. So we're going to have to probably recontour the ridge here just a little. You guys did not get out the piezo. So we have to recontour this ridge right here, ladies.
Do you want the piezo out?
Well, so probably a little simpler just to get out the ball. I guess recontour. Yep, don't have a choice. So we're gonna get out. There are a couple different things that we can do. One is take a ball and recontour this. Another one is the piezo, and right now setting up the piezo is a lot more difficult than the other. So we're gonna go ahead and we're gonna recontour this with we call it's basically a 24 round long shank burr that goes into your slow speed handpiece, and it's pretty simple. You just get in there and recontour things and throw a little water on there, and really it's fairly simple. We're gonna get thank you. So we really don't have to. We gotta take a couple millimeters of bone away, but not too much. We'll see if we can't try to harvest as much of this bone as we can. Try not to suck too much of it away. Let's see if we can't put that. Let's do the green one. Yeah.
Open real wide. Open, open, open.
Real big, buddy.
Open real wide.
Yeah. There you go. Good job. Okay. Well, give me the yellow one. I think we'll get the same effect. So this will open real big, buddy. There we go. All right, let me have that Woodson one, please. Okay. Now, one of the things when you're doing this, you want to try to stay away from. We see okay in there?
Yeah.
Okay. Suction right down in there on the lingual. There you go. Thank you. Okay. So now we're going to go with our lance drill. And we just want to make sure, even though I know we've got lots of height, I've only got 16 plus millimeters, so all right. Okie dokie. So one thing you're going to see here, this is angled like so, this is like so. All right, so we got to make sure everything does exactly what we want it to do. Look good, ladies?
Move your section a second. Yeah, it looks good.
Thank you. All right, so go with our pilot drill, please. So yes, and so we're going to need to be looking at that 325. Yeah, because we can't go to the 3.5. I don't think I've got enough space. So we're gonna go ahead, and we want to stay a minimum of 1.5 millimeters away from a natural tooth, and we want to try to get a minimum of 3 millimeters between, but ideally 4. So we got these little lower anteriors. We definitely want to try to keep the spacing really good.
2.0.
Okay. All right, there we go. Give me a 9. Thank you. All right.
Oh, it's good.
So now we're just going to kind of come in here. What are we at there?
13. You're at 16 on the distal.
Yeah,
For sure.
okay. Let's go to our next drill. So as you can see, we start using some of these different sizes. Sometimes you don't have to do very many drills in order to,
Final drill for the 325.
so
That looks good. You're hitting the mesial, I think they're getting past it now. I can't see past the
Okay.
fistula.
Keep that bone, please. Okay. Let me have. You got a little piece that I can put in there, or I can use it.
Like a tri-end?
Yeah.
They
Or
don't have tri-end, so I'll give you those.
yeah. Give me the burr. That's great. Yeah. That's great. Yeah. Okay. That's 13 on the facial. Is that what I'm seeing there? Looks like it.
Yeah.
Okay, so let's take a quick x-ray here, please. Okay. Thank you. Open real big, bud. All right. Open real big. I'm going to take a quick x-ray here now. You're doing great. Pull that back just a little. Sorry, I can't get my hands in there. Hold his lip down for me. There we go. Okay. I'll go ahead and get that lined up for us.
Try that, Karen.
Yep. So, awesome. That looks fantastic. Okay. All right. He's got an abscess right here. And potentially one right there too. So we're going to have to just stuff it. I'm going to put him on an antibiotic right after this. Okay. All right. And open real big, bud. Yep. There we go. All right. Let me have the lance drill again, please.
Did you want that on the extension?
Yep. Thank you. Thank you. Again, there's the angle here. There's going to be a little bit different preparation right here. That looks pretty good.
That looks pretty good.
Okay. Let's go to our pilot drill here now. Wow. This is going to be close.
That's good.
What?
You're at 13, I'm at 16.
Thank you. Let's take another quick x-ray here, please. Yeah, maybe a little close. It's gonna be close. Gotta try to. Got those Gumby lips. Okay.
Try that.
Yeah, because I got to see it so it's not sideways. Yeah. Well, let me have, that's just a little close, and I just don't know that I can get. Hmm. Yeah. 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 I just don't know.
I may have an OCO two-piece 2.9,
Yeah.
if that would help.
Yeah. Let me have, yeah. Yeah, because I just can't, don't believe I can get. I'm just looking at spacing here. I'd like to. Yeah. I just thought, measuring wise, I just thought I had enough space in there. It's just going to be really close. Um, yeah. Okay. Hmm. Yep. It's going to be a tough one. Not sure. Hmm.
I do not have any two-piece, I just have one piece.
Nah, I don't. Not on him. Yeah, I don't.
Thought maybe I might have a couple of little 2 pieces left.
Yeah. Let me see the other drill and see if I can. I might be able to. I'm trying to push this mesially.
Did you say you wanted the liniment? I'm sorry, I didn't hear you.
I already recontoured it.
Oh, okay. So you ready for the implant?
No, I'm ready for the drill.
The final drill?
Yeah, for the 325. Okay. Still doing okay?
Uh-huh. Yep.
How am I doing depth-wise?
You're almost to 13. You're just shy of 13.
Okay. So let me have that drill back. Take the bone off and give me the drill back. Suction down in there. Give me a curette. Thank you. Yep. Wow. I need so there's a sac down here that I saw on the x-ray that we're seeing here, that this has now gotten into. So this is, see that?
Yep.
That's an infection at the apex of 26. So I've now got to make that decision. Kind of knew it was going to be close, but I wasn't sure it was going to be that close. There we go. Yep, now there's a freaking hole to the distal. Oh, man. So there's an abscess that I noticed on our x-ray. Just reviewing things. I wasn't sure whether it was just from trauma, but it's not. It's actually give me that. I need something else that's smaller. Give me that Explorer. See if I can get down in there.
You want that little skinny root tip pick? Would
That might work. Let's give that a go. Yeah. Yeah. my thinking is that, make sure there's nothing. That's all nice and solid and sound. Yay. Yeah, I mean, I got granulation tissue in there that it's hard to make sure that it's going to get out of there. Suction. Alright, let me have that syringe. I want to rinse that and see if I can see in there better.
More water, Jake, please. That wasn't what I was giving you.
No.
Give me that whatever instrument. Yep. Yeah. It just kind of goes out facially. This is where I wish I knew how to do root canals. Because I'd probably do a pulpotomy right now. Haven't done one of those since dental school though. Well, literally it's just a hole down there, guys. I don't know whether to... Let me have the drill. I'm going to put that in there, see what... We'll take an x-ray and see what this looks like. I think I'm just going to be either in that or too close or just... I think I'm probably better off potentially just grafting and lip. Thank you. Okay. I want you to push that back over to this way. There you go. Don't push it down. And push it this way. There you go. Now try that. Yeah. Yeah, we're on a damn arc, but still, it's just too close. Yep. And it's just right into that. So we're gonna graft down in there. So let's put our other implant in. Put the 13 in. We'll graft, and then it's gonna have to get a root canal. We'll probably have to get a root canal on both these teeth. Yeah.
32513.
Okay. cover screw. Thank you.
Did you want both membranes flat?
Yep. Please.
Please. Thank you.
Alrighty then. Well, clean things out as best I could, but it's hard to tell. There's just a sack of pus down in there. So, I'm just, and we'll get some bleeding from the site, but we definitely want to, because we're going to add some bone. We definitely want to make sure we're getting bleeding from the medullarium. Get a lot from here, so that'll help out a ton. Thank you. Well, okay, and blot.
How much more do you need?
Whatever you got in there, just bring it, and we'll put our PRF membranes in there. Don't stress over anything. Don't need to. Now we'll take our membranes and tuck them in buccal linkly here, and then we'll suture this up.
I'll return the favor. Thank you.
All right. Thank you. This is 4, right? So we're going to suture this up, and we'll let him heal. I was hoping to be able to put a healing abutment on this, but couldn't because it didn't have that torque value. So we need to put them on a Z-pack, is that what you're telling me?
Mm-hmm.
I didn't see the allergy on the...
It wasn't.
How'd you find out? Mom just told him?
Julissa doing her job.
Good. Because that was not something that... we reviewed this morning.
It wasn't on alerts or registration.
Yeah, that's what I reviewed this morning in Huddle. So, it's good we do that. Beautiful. Let's get a post-op x-ray with the implant. Well, yeah, with the implant in because we didn't get one. Beautiful. it looks really good. So now we're going to get a post-op X-ray with the implant in or grafting, and then we'll be all set. Is this on one of the low anterior ones? No. Okay.
Try that.
Yep. All right. For sure, we need to. Got to get him to get a root canal on both those teeth. Yep. Yep. All right, so our mantra here now is to get a root canal done. We've got a couple of adjacent teeth. We've got some abscesses. Be able to have him have long-term success. You know, we could have just gone in and taken out those teeth, but then he doesn't get to keep those. So we'll just go ahead and we'll let him heal, get the root canals done, and then we can put another implant in later at a future date. So we're going to sign off here and give him some antibiotics for the infection that he's presently got, and then we'll see him back here in 2 weeks for suture removal. So thank you so much for being a part of the Midwest Implant Institute, and we'll talk to you soon. Bye-bye.